Hey everyone, greetings from Dr. Prepper. Hope you all had fun on New Year's, but it's time to get back to work. So here's another clinical question for us to talk about and look into the concepts around it. And once you start solving these clinical questions well, you will ultimately do very well in your exams. So let's go get you that PG sheet and let's look into today's topic.
So the question for today goes, which of these correctly describes the GCS score of a patient who opens eyes to pain, is on a tracheostomy tube and withdraws from pain? So the correct answer to this question among the given options is A, which is 60 by 15. Now how we arrived at this GCS score is what we're going to look into today's video.
So the topic that we're going to discuss today is the GCS score. So in GCS score, the GCS actually stands for Glasgow Coma Scale. So score actually comes after GCS. So that is one thing to remember. So the score is a total of 15. A lowest score of 3 is possible and a highest score of 15 is what it's given. So you can have any score ranging from 3 by 15 to 15 by 15. It has 3 components, E, V, and M. E stands for eye opening, V stands for verbal response, and M stands for motor response. So these 3 things are individually scored, and then the total gives you your GCS score or your Glasgow Coma Scale score. So this is just a brief pictorial overview of what the GCS score represents. So you have eye opening, verbal response, motor response. Eye opening has a score of 4, verbal response a score of 5, motor has a score of 6. Very tedious to look at it this way. So let's break it down and make it easy to understand. So coming to eye opening. An eye opening can have a higher score of 4, which is spontaneous eye opening. If without any stimulus the patient is opening his eyes, you give him a score of 4. If he opens to calling out his name or any verbal command like a direct open your eyes or just calling out his name, then you give him a score of 3. If he opens his eyes to pain, that means you give him a score of 2. And if he has no eye opening, no matter what the situation, you give him a score of 1. So you can have a score of 1 to 4 for eye opening. Coming to verbal response, which is the V component. So the highest score possible for a verbal response is 5. How do you grade this? If the person is oriented, he is able to answer questions regarding time, place and person properly and correctly, then you give him a score of 5. If he is confused, he does not know what he is saying, then you give him a score of 4. If you give him a score of 3, that means he is able to speak only inappropriate words, but he is speaking coherent words, like he is saying things like go, come, hospital, home. If he is making only incomprehensible sounds, he is not even speaking proper words, you give him a score of 2. And if he has no verbal response whatsoever, you give him a score of 1. Now what I want to point out to you is, it may not be very apparent from whatever you read, but the score of 4 is actually very tricky. Because confused doesn't just mean that he is not answering your questions inappropriately, or he is not able to give correct answers to whatever you are asking. Confused actually means, if you ask him a question like, what is your name? He responds, New York. Yeah, I'm trying to get my point. It just doesn't mean he's not answering correctly or he made a mistake in answering the questions. He's actually confused. So on the safer side, most people either score verbal response as 3 or 5. So that is very important to know. But if you get a question in NEET which says that the person was confused, please go with 4, because 4 verbal response, a V score of 4 means confused. Motor response or M component, it can have a higher score of 6. How you grade the 6? The person follows commands, you tell him to stick out his tongue, he obeys, you tell him to open his eyes, he obeys. So, and E response of 3 might still be a M response of 6, remember that. But let's just, for simplification, let's just say he follows commands. If he localizes pain, then he is able to get a score of 5. If he withdraws from pain, he has a score of 4. If he flexes to pain, he has a response of 3. If he extends to pain, he has a response of 2. And if he has no movement whatsoever, he has a score of 1. So again, the motor response is graded from a score of 1 to 6. So whatever you score an individual based on these 3 components, the total gives you his Glasgow Coma Scale or the GCS score. So now I want to talk to you about some googlies that can be thrown your way based on these questions from these topics. So the first is, how do you elicit this response? I have told you eye opening to pain, or motor response to pain, flexes to pain, extends to pain. What does this pain mean? Do you just pinch him? What does it actually mean? So that is what I'm going to explain. How do you give a painful stimulus to assess someone's GCS? So very important thing to understand about how to check GCS scoring is that how do you elicit these responses? So these responses are often to calling. So your calling needs to be firm, as in Dr. Prepper, Dr. Prepper. So calling the name out loudly and clearly is what, if it gets you a response, is what is called as response to calling. The next thing is pain. So a lot of the things that I've described in this video go like response to pain, eye opening to pain, flexes to pain. So how do you give this pain? Do you pinch them? Do you tell them how they're not good enough? No. So how you give this pain is there's two types. So one is central pain and one is peripheral pain. For central pain, you use your knuckles and you give them what you call a sternal rub. So you rub on the sternum really hard, and if you all try it, you will realize that's actually very painful. It has to be really firm for it to cause pain. So do it on yourselves if you want to know how much you need to do to actually elicit a response. So that is the central pain we are talking about. The other thing that I want to tell you is peripheral pain. So how do you give peripheral pain? So you take a pen and you see this part of the nail that merges with the skin. At that part, you have to press with your pen really hard. And if you do that, you'll realize how painful that is. So that is what peripheral pain stimulus looks like. It's very important to know how you give this pain so that you can elicit a response for your GCS scoring. So now that you have understood how to give a painful stimulus to a patient to assess GCS, I am sure you will be able to get a correct score. Now, what is the lowest score possible? So like I mentioned earlier, but you may have forgotten because it slipped past. The lowest score possible for a GCS is 3. So if you ever see an option which is less than 3, like a 0, 1 or 2, automatically you can eliminate that option because that option has to be wrong. You cannot have a GCS of less than 3. Coming to the next thing, a GCS is almost always stated with a pupil description. Pupils are 2 millimeters, bilaterally equal and reacting. There is anisocoria, which means the pupils are different in size. One is fixed and dilated, one is reactive. You might hear all these things in clinical scenarios. So you need to know that pupils have no role in GCS scoring. A pupil is, you might often get a question where the component of GCS are mentioned. It might also be written as, but the pupils are anisocoric. And you seem like there's a confounding factor. But you must remember that pupils play no role in the GCS. So you need to know that no matter what they say about the pupils, what you have scored based on your EVM remains the GCS score. Coming to exceptions. So there's a certain situations in which there is an exception to GCS scoring. The most common of that is when a patient is intubated or he has a tracheostomy. How do you score then? So if the patient is on a tube or has a tracheostomy tube or an endotracheal tube inside his throat, the V score becomes automatically T. So when you write, you may write E2 VT M5. So a score will be written as 7T by 15. And that is how we got to the answer of our question. If he opens eyes to pain and only withdraws to pain, what is his GCS score? So you must remember, if you go through the tables and then revisit that question, you will easily be able to identify what his GCS score was. So remember, some people say as non-recordable or N, or most people say a V score of T if the patient is intubated or he has a tracheostomy. So the last thing that I want to tell you is about rigidity. So a lot of people, when they talk about a M score of 2 or 3, they describe a score of 3 as decorticate rigidity and 4 as decerebrate rigidity. So let's look at what that really means. I would like you to focus on these two pictures which demonstrate what decorticate and decerebrate posturing is. So as you can see in decorticate, the wrists are in flexion, the elbow is in flexion, the shoulders are in adduction, the knees are in extension and the ankles are in plantar flexion. So you need to remember that. If you look at decerebrate posturing, you see that the shoulders are the same, but the elbows are in extension, the forearms are in pronation, and the wrists are in flexion. So you must remember these two positions because decerebrate posturing is an M score of 2, but a decorticate posturing is an M score of 3. So remember, if someone has mentioned not the score as 3 or 2, it might mean decerebrate or decorticate. If someone has said there is decorticate rigidity, and M score becomes 3. So this is an important correlation you guys need to know because they could just mention about decorticate or decelerate posturing while they are asking you the question. So coming back to the motor response, there's another key difference that I want you guys to understand is in a clinical scenario, sometimes it gets very difficult to differentiate withdrawal from pain with flexes to pain. So someone, if you give them peripheral stimulus like I demonstrated earlier, if you give them stimulus on their fingers and they flex their elbow, is that withdrawal to pain or is it flexion to pain? So how we can differentiate this is very important to know is you keep the limb already flexed and then you give stimulus. If he extends, means he's withdrawing to pain. If he continues flexing beyond however much it was already flexed, that means that response is flexes to pain. So that differentiates between your score of 4 to 3. So that is another thing that is very important to know. So I just want to help you with that whole flexes to pain and withdraws to pain by a demonstration. So you do that by giving a patient peripheral pain. So as I explained earlier, the pen on the finger. So now if your patient is lying in front of you and give them peripheral pain and he does this, does that count as flexion to pain or withdrawal to pain because he's trying to withdraw? So what you do is, if you want to distinguish, you put the hand already in flexion. If you give peripheral stimulus now and the patient extends, that means he's trying to withdraw from the pain or try to go away. But if his hand is already in flexion and you press again and he continues flexing, that means the response is flexes to pain, and that is a motor score of 3. If he withdraws from pain, that is a motor score of 4. So that's very important to distinguish and know how to elicit that response. Let's stop with that much for today. Hope you liked the video and please show us that by hitting the like button. Share this video if you want others to benefit from it also, and subscribe to the channel for more videos like this. If you really want me to discuss any other clinical topics, please let me know in the comment section. Also, I would like you to remind you to stay inside, stay safe, wear your masks and observe social distancing to stay away from this Omicron variant. I really hope you guys put in the hard work. All the best for your NEET. Keep up the good work.